Hello, my Diet Tribe. Welcome to another video session of Let's Talk Diabetes with Nkiruka. Today, I will be giving you tips on how to prepare for pregnancy if you live with diabetes. It would interest you to know that you can have a healthy baby and pregnancy even if you live with diabetes. So this actually demystifies the myth that keeps going around that women living with diabetes cannot have children or keep a pregnancy. This is totally untrue. So to be successful in having a healthy pregnancy and baby, all you need to do is pre-plan your pregnancy. So the next question will be, how do you pre-plan and prepare for pregnancy if you live with diabetes? Simple. Start off by making a healthy lifestyle choice, like eating a well-balanced diet in the right portion, getting more active, and taking your medication as prescribed by your healthcare professional. So, keeping your diabetes in target ranges is also very, very, very important. So, for your fasting blood sugar levels, we should be looking at 5 to 7 millimole per liter or 90 to 126 mg per dl. That's after 8 to 12 hours of fasting. And then before meal, we should expect you to keep your blood sugars within the target ranges of 4 to 7. So that's 72 mg per dl to 126 mg per dl. And after 3 hours of your meal, we expect that you should have 5 to 9 millimole per liter or 90 to 162 mg per dl. Another thing that you should also be wary about is what we call the HbA1c, and your target should be about 48 millimole per mole or 6.5%. And you should also take a high dose of folic acid. So these are a few tips. Take your medications as prescribed and get your eyes and kidneys checked, because when you get pregnant, the whole pregnancy affects your eyes and your kidneys. So before you even think about getting pregnant, you need to check and see that everything is okay with your eyes and your kidneys. And the last but the most important, if you're on any form of contraception, make sure you use it well until you are ready to conceive. So that is the first thing that you should do. Make sure your contraception is in place. Then you go by all these wee tips that I've just given you to help you pre-plan and plan your pregnancy. And you should also have a consultation with your healthcare professionals, and they will guide you through on how to go about keeping all these tips which I have given you to help you pre-plan 3 to 6 months before you even decide to conceive. So what possible risk do you need to know if you're planning for a pregnancy and you live with diabetes? Number one, I earlier mentioned your eyesight and kidney function would worsen during pregnancy. So it is wise for you to know what your kidney functions are before you even decide to get pregnant, and do your routine eye check to check for any form of retinopathy and compare to when you're pregnant. And you should also have in mind that there's a very, very high possibility of having an overweight baby, and also the possibility of a miscarriage, and your baby might be born with some serious health problems. So these are the possible risks that you need to have at the back of your mind when you're planning a pregnancy. So why is it important for us to pre-plan a pregnancy? It is important because it gives you enough time to prepare and look after yourself before you start looking after an unborn child. It gives you time as well to plan for a healthy pregnancy and have a healthy baby. Managing diabetes when you're pregnant, to be honest, is a full-time job, and this involves so many appointments, tests and scans. This takes a great deal of commitment. So that is why it's very, very important for you to pre-plan and get yourself ready before you get pregnant. So remember, visit your healthcare professionals for the pre-planned pregnancy counseling. It's very, very important. It's easy. All you just need to do is be calm, prepare your mind, tell yourself, I can do it, and you've got that done. So this is me again. Remember, like, subscribe, and hit the notification bell for more exciting videos from Let's Talk Diabetes with Nkiruka. Bye.